Behavioral Neuroscience, Chapter 16, Segment 3. Depression is a psychiatric condition characterized by such symptoms as an unhappy mood, loss of interest, energy and appetite, and difficulty concentrating. Unipolar depression alternates with normal emotional states and can occur with no readily apparent stress. Depression often lasts several months and affects 13 to 20% of the population at one time. About 80% of all suicide victims are profoundly depressed. The concordance rate for depression is higher in monozygotic twins than in dizygotic twins. Adoption studies of people with depression show higher rates of depression in biological parents than the adoptive parents. PET scans suggest greater activity in the prefrontal cortex and amygdala in depressed patients. Blood flow is also decreased in systems implicated in attention, such as the anterior cingulate. Electroconvulsive therapy, or ECT, also known as shock therapy, is a last resort treatment for intractable depression in which a strong electric current is passed through the brain, causing a seizure. The monoamine hypothesis is the hypothesis that depression is caused by reduced activity of one or more monoamine transmitters, such as serotonin. The first antidepressants inhibited monoamine oxidase, an enzyme that breaks down and thereby inactivates monoamine transmitters. Reserpine is a drug that causes the depletion of monoamines and can lead to depression. Tricyclics are a second-generation antidepressants that act by increasing the synaptic accumulation of serotonin and norepinephrine, which are monoamines. Selective serotonin reuptake inhibitors, or SSRIs, are a class of drugs that block the reuptake of transmitter at serotonergic synapses, commonly used to treat depression. In one study, SSRIs were only more effective than a placebo for those who were severely depressed. SSRIs pose a greater risk of suicide and serotonin syndrome, a syndrome of confusion, muscle spasms, and fever that may occur when brain levels of serotonin are too high. Other treatments being studied for depression are ketamines and vagal nerve stimulation, which is very expensive. Deep brain stimulation, or DBS, is mild electrical stimulation through an electrode that is surgically implanted deep in the brain. Cognitive behavioral therapy, or CBT, is a psychotherapy aimed at correcting negative thinking and improving interpersonal relationships. Cushing syndrome is a condition in which levels of adrenal glucocorticoids are abnormally high. People with this syndrome are prone to depression, suggesting that the hypothalamic pituitary adrenal axis may be involved in depression. Suicide victims and hospitalized patients with depression show elevated cortisol levels, and these findings suggest that ACTH is released in excessive amounts by the anterior pituitary. Dexamethasone suppression test is a test of pituitary adrenal function in which the participant is given dexamethasone, a synthetic glucocorticoid hormone, which should cause a decrease in the production of adrenal corticosteroids. Dexamethasone ordinarily suppresses the early morning rise in ACTH and seems to fool the hypothalamus into believing that there is a high level of circulating cortisol when given at night. Depression is often related to events in the female reproductive cycle. Postpartum depression is a bout of depression that afflicts women around the time she gives birth. It may not be safe for a woman to take SSRIs while pregnant. Depressed people spend little or no time in stage 3 sleep and more time in stages 1 and 2. Depressed patients seem to enter REM sleep much sooner after sleep onset. Learned helplessness is a learning paradigm in which individuals are subjected to inescapable unpleasant conditions. It has been linked to a decrease in serotonin function. Removing the olfactory bulb from rats resulted in signs of depression. Seasonal affective disorder, or SAD, is a depression putatively brought about by the short days of winter. It is more common in women and generally starts in early adulthood. Light therapy, or phototherapy, resembles the treatment of antidepressant drugs for this type of depression.